thank you to the incredible witnesses we have on the Finance Committee today. Your opening remarks were very powerful, so thank you very much for those. My questions are for Nina Laboon, CEO of Donwood Manor Personal Care Home here in Northeast Winnipeg. Nina, thank you so much to you and to Donwood for the extraordinary care you have been giving residents over the course of this pandemic and for the past 50 years. As we know, it's your 50-year anniversary this year. So Nina, can you tell the committee what the experience has been for your workforce? What has the impact been on them during this pandemic? We know that, as you mentioned in your opening remarks, that the nurses and the support staff are predominantly women. So what has the impact been on them?
I think actually the previous MP alluded to this. It's hard to put a pulse on it, but there is a really significant amount of underlying stress and anxiety that this has come. And you see it in perhaps the concrete ways of trying to juggle childcare, increase sick time, overtime. But I really think the pandemic has, again, illuminated what we have known about long-term care for a very long time. It works because of the resourcefulness of the staff who are in the system. And it's been pushed past that at the point that we're in right now.
Thank you. And what would you say the impact has been on residents? And has there been a difference and impact on the women residents versus the male residents?
For sure. So just speaking from my own care home, 85% of our resident population are females. Average age is 91 in one site. So very frail senior population. We also have seen, sadly, an increased number of deaths in the last 12 weeks, not COVID related, but loneliness has an impact on one's health. So it's been incredibly difficult for our female seniors and also for their female caregivers, family informal caregivers who cannot come in the home. So all those unmeasured impacts are really difficult.
Yes, we've been hearing that anecdotally across Kildonan and St. Paul from folks who have very senior residents in their family and care homes, that the loneliness is palpable and it's been very challenging. Have there been increased financial impacts on Donwood to accommodate for the health recommendations of physical distancing, PPE, extra hygiene requirements, perhaps staff shortages?
Yeah, very significant. So we're at about week 12 here in Manitoba, and we're looking at about 120,000 of costs that we've been able to track thus far. I have a purchase agreement to service arrangement with our government that requires us to have no deficit at fiscal year end, which is truly not going to be possible because of circumstances out of our control. So I really think there needs to be a look at concrete funding to fill those gaps. Because I'm not alone. Every site we've just done what's needed to protect the seniors in our care and prioritize that over the dollars.
Thank you. And have you had any difficulty accessing PPE for your staff and residents?
We have not, which is amazingly due in part to our incredible nursing leadership and ingenuity in, making simple things people may not be aware, but hand sanitizers only work in certain dispensers. So you get really creative to make sure that our staff have the protection that they need.
That's very good to hear. I know not all personal care homes have had that same positive experience. That's a relief. So we know that personal care homes, of course, have been disproportionately impacted during the COVID-19 pandemic. Over half of the deaths in Canada have been attributed to elderly care homes. What role do you see the government playing for elderly care homes moving forward?
I'm a firm believer that quality of work life impacts the quality of care that will be provided in long-term care. And I really think a key, although it's not currently federally funded in terms of long-term care specifically, a key area that can be looked at is the regulation of care in long-term care sites, and specifically regulation of the currently unregulated care providers. So PSWs, healthcare aides across Canada have very minimal educational preparation. And yet they are the hands and feet of care in our facilities. They constitute most of our workforce, and we all know that seniors care, and they are not being given the skills and education and resources to be well prepared for the roles that we're asking them to fulfill.
We'll have to end it there. Thank you.
Nina.
Thank you all.
Thank you, Chair.
Just while we're on you, on the witness here, Ms. Lebrun, I believe you mentioned in the beginning the number of people working two jobs, mainly women, and we've seen that a lot in the homes in Quebec and elsewhere across the country. So what's the reason for that? I mean, I've always assumed the reason for people having to work in two jobs is because the business doesn't want to pay benefits. In terms of your presentation, what is the underlying reason for if a person's working in a home, why wouldn't they just be working in the one home, paid decent wages and getting the benefits? But here they are working two homes to survive, which also puts people at greater risks in terms of the transmission of disease.
Thank you for that question. There's lots of complexities to the HR piece and the collective agreements that we have to fit within in terms of the types of positions we have and are able to create. So most of my staff will have multiple, a 0.4, for example, and a 0.6 and a 0.8. They'll add up their positions across sites. So a few weeks ago, Manitoba moved to a single site employer for long-term care. And as a compromise and as a way for women to not be impacted by a salary cut, they are now allowed to hold 1.3 of a full-time position at one site. And it is because of remuneration. It's insufficient pay to support a family.